report.
Thanks, Greg. It is 7:44. President Obama's health care initiative hits the road, and today the show is in California. Today there will be gatherings in Oakland, San Diego, and Clovis in Fresno County that will be linked with the main event in L.A. hosted by Governor Schwarzenegger. Joining me now to discuss the federal effort to change health care is Congresswoman Jackie Speier. Good morning. Thank you for being here.
My pleasure, Tori.
So can you tell us briefly what's going to be happening at today's forum?
There are experts being invited from all over the state to join in to discuss what should be the elements of a health care initiative that the federal government undertakes. So it should be wide-ranging, to say the least.
Now, I mean, we were talking a little bit earlier in the break that health care is becoming such a problem. It's become so expensive. And even if you have COBRA, if you lose your job, you could pay thousands of dollars a month. What can the government do so that health care is actually affordable?
Well, part of what we have to do is bring down the costs. Now, in terms of the COBRA individuals today, they will get a 65% rebate, in effect, for the cost of their COBRA for 9 months. And that was part of what we did in the stimulus package to try and assist those who are unemployed. But the costs have to be brought down. And one of the areas that I'm looking at is the whole area of imaging. Believe it or not, it's a $100 billion a year cost. And anywhere between 20 and 50% of those images, unnecessary.
Wow. So if you get rid of taking all those images, talking about x-rays and that kind of thing?
MRIs, PET scans, heart scans, unbelievable the cost associated with them. Many of them now unnecessary and often with old equipment that doesn't even give you a good reading.
Now, Clinton's effort, we all remember that, to try and change health care back in '94, unfortunately, because of competing interests, among other reasons, completely failed. Are Democrats and Republicans, are you getting sense they're all on the same page this time around?
No. You know, much like John McCain talked about giving everyone just a tax deduction or a tax credit, or creating what are called these health accounts that you can put money into, different approach altogether. What we do need to find is an opportunity where people have choices, but that we are realistic about what's the expectation. Australia spends half as much money on health care as we do, has better long-term results. People live longer and better results along the way. We've got to do it differently.
So there is a realistic way to make it better. Are you optimistic we're going to see substantial health care reform in this administration?
I think there's no question. He's made it one of the hallmarks of his candidacy and of his presidency. There's so much money set aside for IT, which is part of the solution. To get the solution, you've got to get the data to see how much we're spending on all these various services.
On a different topic, before I let you go, I'd like to ask you about this weekend's launch in North Korea. How concerned should we be about this?
Well, we have to be very concerned, and I think the UN resolutions historically haven't had the teeth, and they feel that they can do this with impunity, which they should not be able to. We've got to bring China on board, though. China is the influence that will force North Korea to take different tacks.
And what do you think about President Obama's call for nuclear disarmament? I mean, can he take this on in addition to dealing with the economic crisis?
He's a pretty remarkable individual. I mean, even the press corps on his trip has said that they're exhausted. He's just unbelievable in terms of his energy. I think he's going to be able to do remarkable things for our country.
All right. Thank you, Jackie Speier, Congressman from San Mateo, joining us. And if you would like to see the health forum, it is being webcast at 10:30 this morning. You can go to our website, ktvu.com, for a link to that. Time right now is 7:47. Back to Greg.